Hi, welcome to County Business. I'm Alice Lai-Bitker, Alameda County Supervisor for District 3. Today we're going to spend time to talk about our seniors, some of the needs, some of the services that's available, and what we're trying to do in the county and state level. And I have three very special guests with me. First, we have Lisa Lahau. She is with Adult and Aging Services with Alameda County Social Service Agency. And we have Tracy Murray, and Tracy is the Assistant Director for Area Agency on Aging.
Yes.
And we have Jenny Chung. You're with Insight Center for Economic Development. Thank you all for being here.
Thank you.
And let's start with Lisa. Lisa, you're the Director of the Adult and Aging Services.
I am Director of Public Guardian.
Public Guardians, okay.
Yes.
So let's talk about, give us a big picture in terms of what have you seen that's happening with our seniors in Alameda County in terms of their needs, and what do you see as the Director for the Public Guardians Services?
I see a growing need for the services. All of our services are actually growing in number. Our largest program is in-home supportive services. We currently have nearly 18,000 clients and a great many providers working for those clients. In adult protective services, we serve between 1,500 and 2,000 different individuals every year, and that number is growing yearly. In the Public Guardian's office, we currently have nearly 600 individuals under conservatorship, either a probate conservatorship or mental health conservatorship. We are expecting a great surge in the number of clients as the baby boomers age. Beginning in 2010, there will be huge increases, we believe, in numbers of people that will qualify for our services. Some of the services in the department are driven by economic needs, such as in-home supportive services. Clients must be eligible for Medi-Cal to receive that program, and so it is a needs-based program. The adult protective services and Public Guardian are not needs-driven. Those programs are available to people of any economic background, but are driven by the need for protection and sometimes for court oversight. But just the sheer numbers of elders will definitely drive those numbers higher in the coming years.
And you're talking about our seniors or our elderly population is going to be double within the next 20 years.
That's correct.
And you're predicting the services needs is going to grow tremendously.
It will grow tremendously,
yeah,
yes.
Yeah.
On the other hand, we're not seeing, of course, funding keeping pace with the growing need, particularly with what's happening now in the state of California. Last year, there was a 10% cut to adult protective services statewide, and we are not seeing further cuts in the governor's budget, but there is always the potential that that will be cut further. We are seeing cuts planned for in-home supportive services that could be quite significant.
Yeah, absolutely. That's included in terms of wages for the workers as well. So when you speak to the growth of population and all that, I think that's something that suits Tracy when you do your job in the area on aging. That's something you take into account in terms of development plan, how we meet our future needs. Is that right?
Very much so. And the Area Agency on Aging, every 4 years we develop a needs assessment of the county for seniors, where we poll the seniors as well as their nonprofit providers and lots of other groups. We try to understand where they most need help. Based on that needs assessment, we develop an area plan, which the Board of Supervisors approves, and that plan allows us to provide funding to provide services. And the Area Agency on Aging is fairly unique within the county in that we largely provide services through a network of nonprofit organizations. So we are actually in the midst of our needs assessment right now, and then that will drive our funding decisions and our service delivery system for the next 4 years. you know, in terms of overall perspective, we provide services currently to about 27,000 seniors in the county, and we provide services in a number of areas like food programs, home delivered meals and congregate meals, or legal services or friendly visiting services. Also services that are a little harder for people to really relate to, but they are very, very important, like information and assistance. And that's, you know, that's a really basic need that we see right now, where as the population ages, the seniors themselves and or their family members are really at a loss as to how to even access the services available.
And you have a 1-800 phone number that people can call if they want to have any kind of question about senior services?
That's right. We have an information and assistance number.
Do you remember the number?
Of course not. But I might be able to.
Okay.
So we have an information and assistance number, and our staff are all available. The Area Agency on Aging is a small group. We have about 13 people, but we're all there to help seniors and their families.
Great. So I mentioned earlier that you guys are planning in terms of how to meet the needs of seniors. And Jenny, you are really on top of this so-called elderly index. Can you tell us about that? You know what it is and why are you working on it?
Sure. So the traditional measure for needs, both for families or for seniors, is the federal poverty guidelines, and that was a measure that was developed nearly 50 years ago. The federal poverty guidelines were based on, you know, food survey information in the 1950s, and currently for 2009, for one person, it's only $10,830 a year. So several years ago, we took a look at that number and we figured we need a more accurate assessment of what it actually costs seniors in order to meet their basic needs, not only throughout the continental US, but specifically here in Alameda County, as well as the other counties in California. So what we did a couple of years ago was develop the California Elder Economic Security Standard Index, known as the Elder Index. And what it is it's a cost of living measurement that says how much minimum income seniors need to meet their basic needs in Alameda County. And it varies by housing, food, healthcare, transportation, and other sort of basic costs. So it really captures all of the basic needs that a senior would have in this county. And we've been able to provide the Alameda County Area Agency on Aging, as well as other departments and policymakers, with this information so that they can make better decisions and more effective decisions, especially given that our baby boomers are retiring and that we will have an increased senior population in the coming years.
So this is an index that you develop not just for Alameda County, but all the counties in the state too.
Correct.
But your focus is in California.
Correct. Our focus is in California. It's actually part of a national program